I'm going to start because I think these people are sitting up here and you ought to know them by face. So there's Dr. NICOLE WINBUSH, who will be speaking about a functional approach. There's CADABONA, who's a doctor of Chinese medicine. There's SHARON MEYER, nutritionist. There's Scott LARSEN, doctor of chiropractic. Jennifer SWEENEY, massage therapist, the great brain of the IHH. In our approach to integrative care, it's a process of discovery. And in addition to the experience of a patient appreciating potentially the right fit, the right lens, in our work, care is always individualized and personalized, and there isn't necessarily a presentation that has a clear pathway or a recipe, but it's always for us an active process of discovery. And similarly, as patients receive the opportunity to work with different practitioners, our practitioners benefit from our own interaction with each other. The lens that we each come from with our training expands. And at some point in time, as is the case for me, as I'm going to talk about one of my patients, I've got them in my head. And I'm hearing their thoughts and words, having been able to work together over a period of time. And it becomes not only an endeavor in which patients benefit, but it deeply enriches our work as practitioners, because in a certain way, this is all about deeper understanding of the lives we lead. So DE, our patient, is a 75-year-old whose main presentation is diarrhea and abdominal pain. And this is about 10 years of duration. She comes to see us having been motivated to do so because an emergency room visit for a rapid heart rate. And she tells me that her experience has been, as her diarrhea gets worse, she has periods of rapid heartbeat, and she's wondering if they're related. Additionally, the worse her diarrhea is, it seems to correlate with a worsening of her heart rate. And this was a particularly bad one, which unusually brought her to an emergency room. And after evaluation to make sure she's not dehydrated, doesn't have electrolyte abnormalities, that her heart is actually fine, she's discharged, has a workup to ensure that her heart is okay, and she's coming to see us in our practice to see if there are other things to think about. Going back to 2008, on a family visit to Italy, she has a salad of dandelions and wild greens, and life changes from that moment in which she begins to experience a daily diarrhea and some amount of abdominal pain, which she describes as a pressure. It can be anywhere from 1 to 4 times. The consequence is weathered, but the unpredictability of it, the sometimes concern she has about can she control herself, have rendered her over the years kind of unable to get out of the house in the morning. She waits until she feels safe, and then she can leave and go about a very vital and active and enjoyable day. In addition to her request of us, which is specifically, can you get me out of the house sooner? And can you get me confident and feeling safe about my circumstances? She's gradually taken out of her diet to control the diarrhea what was previously a very wide range of fruits and vegetables that now are reduced in number and or are only eaten after part of a hearty soup that she makes. So her second request is, can I begin eating more fully again? She's also had full evaluation, so at the time we see patients, there's a question of what hat we have. We always have the responsibility to make sure all elements of care are surveyed. She's actually had a full evaluation to make sure there is no infection, there is no inflammatory condition. Her diarrhea is not exactly diagnosed, but she knows that she's safe with no particular concerns. Other things to say about her health in general: she typically is really hardy and will not push herself to do things for common problems. So she has a mild asthma, generally not treated. She has low back pain, almost always tolerated. She's got postnasal drip. And the one thing that she seeks attention for regularly is chronic urinary tract infections, and she's exposed somewhat routinely to antibiotics. Just to kind of round out the picture, she's a woman of, as she says, the 4 principles of life are family, faith, food, and fun. That says a lot about her. She's really vital and active, out and about when she can be out, walking around, socializing, has a very deep and rich engagement with friends and family. Oh, yeah. So to say one other thing about her is she's kind of engaged in her own research. So she has a sense of what's going on in her microbiome. She's put herself on broad-based probiotics. She uses a particular species, Saccharomyces, good for inflammatory conditions. She's treating her own leaky gut as diagnosed by using glutamine, and also takes a vitamin D. That's my part for now. I will see you at the end of your consultations.
Some key considerations with the patient that we just heard about would be potentially infections. I know the history that was shared talked about that she's had some evaluation for those, but depending on how that was done, when that was done, the ability that we have through some of the evaluations that we do in the functional medicine clinic or in the integrative medicine clinic is to look somewhat more comprehensively for infections using some methods that I'll talk about in a moment. And certainly infection can be a cause of chronic diarrhea. Also the sequela, or what happens after someone has and potentially even clears an infection, can cause diarrhea. So for instance, some viruses can actually impact or damage the nervous system that controls the motility or the peristalsis of the gut. Another consideration would of course be the microbiome. This is an evening about the microbiome. And why might we consider microbiome imbalance in this patient? Well, she has had these recurrent urinary tract infections, so there's obviously, through the antibiotics that she's needed to take, can be imbalance of the microbiome that ensues from that. We also heard mention of the ways in which she's chosen over time as a result of the initial infection to shift her diet. And so we heard very eloquently from Dr. Ballantyne about the ways in which our microbiome actually supplies a lot of the enzymes that we need to be able to break down the fibers and the starch and the carbohydrates that are in vegetables. So that's a consideration. And again, it's a complexity model. So it's not that these things were all causal, but they also may be mitigating or mediating what's continuing with her in terms of the digestive symptoms. Other considerations relate to immune, and if you're trying to follow on this diagram, sometimes in functional medicine we have different names for things, so we call the immune system the system of defense and repair. And again, thinking about these urinary tract infections, there's actually a very similar response or part of our immune system or antibody class that's responsible for surveillance and defense in the bladder as there is in the intestine. So that again makes us think about, is there some level of immune dysfunction that's happening here that maybe makes her more prone to contract these infections? So then on our model, what I haven't talked about are the mental, the emotional, and the spiritual spheres that are at the center. So, you know, definitely what we think about, what we believe, the meaning that we give to our symptoms, the ways in which stress can really impact all of those things can impact all aspects of our physical functioning, but in her case, you know, there's quite a level of distress and limitation that's coming from the uncertainty of how she's starting her day. So I'm going to leave it there in terms of some key considerations and then just say, well, how might we go about testing some of this? So comprehensive stool testing is a very commonly employed tool that we'll use, and that allows us to actually get a fairly detailed look at some aspects of the microbiome as measured in the stool, looking at some aspects of the immune function as it relates again to sort of that aspect of surveillance and being able to fight off infections. Looking again very sensitively for a number of parasites as well as bacterial infections, and then also assessing the adequacy of digestion, how well she's breaking down some of her foods. And then we also might check some routine blood work that's very important for intestinal health. And then how would we proceed in terms of treatment? Certainly she's been trying some things on her own, and we could sort of assess either empirically how well those are working for her and continue or make some adjustments, or certainly informed by testing, support other nutrients that might be deficient that are important for digestive health, maybe adding some digestive enzymes to see if that would also be supportive, and certainly if we do stool testing, addressing what we find there. So we would talk together, develop a collaborative care plan, and then proceed forward. And so I'm going to leave it there for my piece and hand it over to Shermi CADABONA, Doctor of Acupuncture and Chinese Medicine, and she's going to talk about how she might approach this case.
As a doctor of Chinese medicine and acupuncture, I'm often met with some confusion from patients who really want to know a little bit of the logic and the science behind Chinese medicine. So let's start with some basics. Acupuncture is one modality that's used within the scope of Chinese medicine. Practice of acupuncture involves the placement of very tiny needles placed on very specific points on the body in order to balance the body's qi or energy and actually tap into the body's natural healing capacity. Getting to this case, this patient's complaint of diarrhea, I would typically start by looking at the earth element, the organs of digestion, the spleen and stomach. But the interesting thing about this case is that the diarrhea occurs only in the mornings. She's pretty much fine from the afternoon on. So why is this interesting? Well, in Chinese medicine, we have certain patterns of disease or imbalance that are all related to certain organs. So not only is this a condition of imbalance in the spleen and stomach, it's also an imbalance in the kidneys. That's, morning diarrhea is associated with the kidney system. So as you can see from the diagram, the kidneys and the spleen have a direct relationship. So what this means is what might have happened most likely is that there was an imbalance in the spleen system, which caused the imbalance in the kidney system. And so that's why her diarrhea is showing up in the morning. Another thing of note is that the patient's other complaints, such as her back pain, in Chinese medicine, back pain is associated with the kidneys, and her urinary tract infections associated with the bladder, those are further evidence that there's some sort of weakness in the kidney system or the water element organs. So moving on to her complaint of the palpitations, of course that corresponds to the heart organ. And as you can see from the diagram, the kidneys and the heart also have a direct relationship. So this patient had a suspicion that there was some relation between her diarrhea and her heart palpitations. And so from a Chinese medicine point of view, that's totally correct. There's a line, see? It's easy. So she has a little bit of anxiety regarding her health condition. That would be related to the wood organs of the liver and gallbladder. And she also has asthma and postnasal drip, and that's associated with the metal organs of the lung. So this patient's acupuncture treatment would include specific points, most located on the arms or the legs, perhaps some on the abdomen. And I would focus mainly on balancing the kidney and heart system. But in that process, the rest of the organs would benefit just because of this interrelationship that they have. So for further support, I would turn to my colleague here, and Sharon will give you some information about nutrition.
You are absolutely unique. There's no one in this auditorium that shares your biochemistry. So when we look at that uniqueness, it's called bio-individuality, which means that there is no specific diet or there's no perfect diet for everyone. You have to find the thing that works with your genes. So the old adage, one man's meat is another man's poison, is very applicable to the diet. And how you react to those foods is going to be very different. So we always look at 3 different ways of assessing this. We look at allergies, and allergies is the most immediate and most potential of the allergies. The next thing is looking at food sensitivities. This is also an immune reaction, but this is not as immediate. It's a little slower. You can have small amounts of those foods and they don't affect you. But if you continue to eat them every day and probably huge loads, you'll have some kind of impact from them as well. They also linked a little with leaky gut. And then the third thing we look at is the food intolerances. So unlike the allergies and the food sensitivities, they don't really directly influence the immune system. They occur when the body is unable to digest certain foods, like milk and lactase, or that kind of thing can cause some of the irritation in the gut too. But usually the food intolerances is about the result of enzyme deficiency. So we probably need to shore that up a little bit more. These are the symptoms of food intolerances and sensitivities: heart palpitations, IBS-y things, bloating, migraines, rhinitis, which is runny nose, and all the rest. But she is having heart palpitations, she's got the diarrhea, and she's got the runny nose. So 3 symptoms out of there. So what I would do with this patient, I would certainly put on some ox bile or some betaine, those kinds of enzymes to support her. And I would give her specific probiotics, because this is a conversation around the biome today. And I'd use plantarum because it's a single strain and it helps to reduce inflammation. I might even give her some electrolytes, because that palpitation might be because she's a little dehydrated. And then I would probably put on an 8-week elimination diet. And it really would be lots of vegetables, protein, and bone broth. And then after the 8 weeks, I'd slowly and very systematically bring in different types of foods. So that's my take on this. Now I want to introduce you to Scott, who's absolutely amazing.
True.
All right, what's up, everybody? This is definitely the dream team for your gut problems. I can tell you that. And the message I want to stress tonight is that whatever is stressing you out is definitely going to kill you. If it's your commute, if it's your boss, if it's that achy neck, it's not doing you any good. And the thing about it is, coming from a chiropractic approach, every day I see people with incredible challenges regarding their gut health, and not one of them has a body that's really soft or not full of spasms or trigger points or things going on in the body that makes their life incredibly uncomfortable. And what happens is, as you go through life and go through all those traumas and stresses, your body stores all that stuff and it doesn't come back out. It's cumulative, and it's kind of a slow build for some of us. Other people are less fortunate, and maybe you have several car accidents in a row, or maybe you fall down, or maybe your boss just enters the room and the stress goes into your body. But regardless of the source of that stress, you got to get the stress back out of the body. And to do that, you need techniques. And that's kind of where I come into play. I'll give you techniques either to do at home. This patient, for example, prefers not to do a lot of treatment, which I totally respect. I would refer to that as the punk rock patient, the DIY patient. So maybe just one visit where we can learn some techniques and a strategy. If you don't have strategy and you don't have techniques, the stress is not coming out of your body. But if you want to do treatment, we can do it. And the effects of seeing me are lasting, and yeah, they really can calm down your body. And when I say the body, I'm talking about your nervous system. And your nervous system is what regulates your gut. And so when your nervous system's freaked out, you're going to have problems. And so get the stress out, identify it. You need techniques and you need a strategy. So don't ignore those achy things in your body. Thank you.
With very few exceptions, massage therapy has health benefits for all patients. Really, there are very few exceptions, and it's due to some very basic biologic changes that take place in massage, in just a straightforward massage within the space of 50 minutes. The biologic changes have to do with the immune system. Your lymphocytes, which are important cells in fighting disease, actually increase to a very significant degree. And then certain hormones that trigger cortisol, which is a stress hormone. And if your body is bathed in cortisol as you live in a very high stress mode, that cortisol really takes a toll on your body and your body's functions. And so massage helps dampen the hormones that trigger cortisol and overall reduce the amount of cortisol in your body. And finally, the last thing that is a biologic change that takes place is that your body makes a transition in massage from your sympathetic nervous system, which is a state of being in which you're in a high stress, fight or flight, high vigilance mode. Again, lots of cortisol. That if it's sustained can, again, take a big toll on your body. And it transitions you into something called the parasympathetic nervous system, which is your state of being when you are calm. It's reflected in your heart rate, your respiratory rate. Your body takes a step down, the cortisol goes away, and you're in a place where you're going to be open to healing. For patients who are going through a chronic issue or a complicated issue, something that they've been dealing with for a long time, sometimes with a lot of mystery about where it's coming from or why it's happening, they're going through a lot of diagnostic testing, they're getting a lot of stressful information and input. Massage is respite. So in the course of a treatment for something, what happens in massage is that it's healing in the context of just letting go and releasing and emptying your mind and sort of receiving healing without stress or fear. For this patient, what I would do is the first thing I would do is check in with the patient to hear her describe to me what's going on with her and what she might be interested or curious or needing me to do, because sometimes patients say different things to different practitioners, and it's important what they want you to hear. And then I would probably work very hard to do a massage that is slow, that is medium pressure, that is warm, and helps the patient go to the parasympathetic nervous system, because I want to interrupt the loop that she's in of feeling symptoms, those symptoms giving distress, increasing anxiety, making the symptoms worse and leading to even worse symptoms like heart palpitations. And then I guess the last thing would be that I would probably teach her some self-massage techniques and some acupressure points that address digestive issues and tension, because those were tools that she could probably use whenever she did experience symptoms. And again, it becomes something that she can do to take control of her life and essentially leave the house. And when she's away from the house, get to a point of relaxation with self-comforting.
So I'll give you the story that emerged for our patient and link it with certain things. One is a treatment option wasn't initially on the table. And as we talked about what she really wanted out of consultation, and this is sometimes the issue of where diagnosis becomes important, is she wanted to understand what was going on. It was actually more bothersome than she initially presented, the idea out of control in this way for so long without a decent explanation. So for her, doing some stool testing as a way of getting a better sense of what the physiology leading this was right. She would not have been opposed to other things, and the first thing she wanted, in addition to getting out of the house, was to eat more. Comprehensive digestive stool takes about 3 weeks to get back. And as is often the case, one of the humbling aspects of practice is you think it through, you think you know what's going on, and you might have had the experience in the past where you make an appointment to see a doctor, and by the time that appointment comes, you're feeling better. Sometimes it happens as a second step. You come, you get seen, diagnostic tests get ordered, and you come back feeling a lot better. And there was a quality in the way she was better, which was kind of interesting, right? Because if we say that her condition state was one of insecurity and vulnerability as a secondary concern, she came back confident in her body. And she had made some changes on her own with some of the things she was doing. And she was kind of interested in the results of the test, and also kind of dismissive that they were as important as she thought they would be. She had a low diversity number of organisms, and she had some overgrowth in organisms that weren't particularly advantageous, and she had a minimization of some of the healthy bacteria. So there was stuff on testing that potentially supported doing some stuff with digestion, with mucosal membrane, minimizing irritability, with advancing a different kind of probiotic for her. And what she chose to do is she wanted to start eating better. She understood that having reduced, and we see this all the time in practice, people begin to withhold food as a logical first step, and it just creates a cycle of dysregulation. So in the end, she went back to what she was hoping for as the first primary way of feeling better. And I'll see her again within another couple of weeks. So I guess the take home and what we had hoped for in this part of the presentation was a look at some of the tenets underlying an integrative approach, right? So one of them is a belief, a respect for, and a cultivation of one's inner sense of how I heal. That because so many things work in the right setting, making sure that there's an appropriate fit with somebody so that they're expressing how they want to work with their body and learn how to work their body becomes a fundamental. The approach is just another pathway to discover what is real, what is true, and who we are. And with that, I thank you.